So this is a quick video on some of the definitions from Unit 1, homeostasis and disease. So we'll start with homeostasis itself. As you know from previous courses, homeostasis is the concept that we maintain a constant internal environment despite changes externally. It's maintaining normal values, really. In previous courses, you've talked about positive and negative feedback and a way of maintaining a constant internal environment. You've used analogies of thermostats and furnaces and air conditioners, likely, and so that you have some sort of a sensor, an integration unit, and an effector, and you maintain an environment that way. So this would be things like maintaining the pH of blood, for instance. So along with homeostasis is the idea of allostasis. So homeo means the same, allo means variable. So allostasis is the physiological reactions that allow homeostasis. So it would be things like when the stressor is, say, for instance, is exercise, and homeostasis is trying to keep adequate oxygenation to the tissues, and oxygen is being used quickly, then allostasis is the process by which you increase cardiac output, you increase the contractility and the heart rate of the heart, and therefore increase the amount of blood flow to the tissues. That concept is allostasis. So it really is kind of the things that you change in order to counteract the stressor. In the PowerPoints, we'll spend more time talking about that. So the concept of homeostasis, if you think of it as driving down the road, that homeostasis is staying within certain limits. So you're staying between the yellow line and the shoulder of the road. Now the car sometimes is closer to the center line, sometimes it's closer to the shoulder. It varies within the parameter of your lane. Disease happens when homeostasis can't maintain that control and you end up outside of those parameters. So disease is you end up with two wheels on the shoulder of the road. The ride gets very bumpy and very tense. Now, recovery from disease is pulling it back onto the road and getting back to normal homeostasis. So pathophysiology is the processes of why the disease occurs, the physiology of what's going wrong. For years, I've used the analogy of Goldilocks and the three bears to describe these things. If physiology is baby bear, where everything is just right, pathology is mama bear and papa bear. So it's too hard or too soft, too hot or too cold, etc. And physiology is just right. So pathophysiology is where does the physiology go wrong? Okay, diagnosis. It is naming a disease. It is figuring out what's gone wrong by evaluating the signs and symptoms, by doing lab tests, by taking proper history, by comparing what you find to other known cases. So making a diagnosis, which means to know through, to share the knowledge. Signs are objective disease indicators, and symptoms are subjective indicators. So, nausea is a symptom. You feel nauseated. Vomiting is a sign because the nurse can see you that you have vomited, so that's a sign. Blood pressure is a sign. Headache is a symptom. So symptom is what the subject feels, and they can very adequately describe it. Pain is a symptom. Signs are things that can be objectively measured or objectively observed. Etiology is the causative factors. So lung cancer, one of the etiologies is smoking. It's inflammatory processes. An etiology in rheumatoid arthritis is an autoimmune attack on the synovial membrane of joints, things like that. So etiology, where does it come from? What's causing it? Idiopathic is when we don't know the etiology. So idiopathic simply means we're not certain why this has happened. So my father had idiopathic pulmonary fibrosis. That's what they called it. That was his diagnosis. And that meant scar tissue in the lungs from unknown causes. A lot of things are idiopathic, and a lot of things that were idiopathic, research starts to uncover, and they stop being idiopathic, and we start to have a more defined etiology. Iatrogenic, it means that it's caused by the treatment or caused by the procedure. So it could be mistakes, or it just could be side effects. So an iatrogenic infection might follow surgery. Nosocomial is another word that is similar, that it happens because of the procedure that's happened. Getting C. difficile while you're in the hospital is iatrogenic because of the use of antibiotics in that setting. Predisposing factors are tendencies that promote the disease development. So I have a weak heart valve, and that predisposes me to certain cardiac problems. It doesn't directly cause it, it just means that if there's going to be something go wrong there, it's probably going to be here. So genetics oftentimes are predisposing factors, things that run in the family. Bowel cancer runs in my family, and so I have predisposing genetics for bowel cancer. But I don't have bowel cancer. I get regular colonoscopies to check, to make sure, because of those predisposing factors. Now, precipitating factors are things that triggered the acute episode. So being exposed to a virus will precipitate the infection. You know, I'm all of a sudden at a loss. Falling will precipitate a fracture of bone. Prevention is doing things that will reduce the risk. So stopping smoking will reduce the risk of cardiovascular disease, of cancer, and a few other things. Eating more fiber is preventative of a lot of GI issues, etc. So behaviors that reduce risk. Vaccination is prevention. Reduce the risk of getting the flu or whatever you've been vaccinated against. Those are preventative measures. The biggest problem with prevention is quantifying it. It's like, how do we know that this worked in prevention and you didn't get the disease? How do we know that you were going to get the disease if you didn't do that thing? So prevention in medicine is given a lot of lip service, but not given a lot of respect. So, for instance, there's people who believe that drinking chaga tea is preventative of a lot of cancers. Well, who's to say? I've never drank chaga tea and I've never had lung cancer. So if I was drinking chaga tea and I didn't have lung cancer, does that mean that it's an effective preventive measure? I don't know. This is open to a lot of debate and a lot of interpretation. You have to look at predisposing factors, precipitating factors, and what was done in prevention, and then it's statistical. One of the things that we have to really be cognizant of is that anecdotal evidence is not good evidence. That you can't say that, well, my aunt did this, did yoga, and doesn't have osteoporosis. Well, did the yoga really prevent the osteoporosis? That's considered anecdotal evidence. Anecdotal evidence starts to mean something when the sample numbers get big enough that statistically trends can be analyzed. What are those numbers? That varies, and that's a difficult concept, and it's open to a lot of debate. Okay, so here's a few more. So pathogenesis is the sequence of events that of the disease with respect to changes in tissue. So pathogenesis. Genesis is the source. It's the first book. It is generate, genesis. It's the same word. Patho is disease. So the sequence of events that lead to the disease. Onset. It can be acute or it can be insidious, gradual. So one of the things about influenza, everything has flu-like symptoms. All viral infections have flu-like symptoms. The distinguishing thing about the flu is there is a very abrupt acute onset. It's not gradual at all. You feel fine, you feel fine, you feel fine, then you're sick as a dog. Acute usually refers to sudden, short, often severe disease. Now, it doesn't necessarily have to be severe, but it often is used that way. An acute infection kind of also insinuates that you are going to get better from it, that there's no histological change, that what happens is there is an allostasis, there's something, and it makes you sick, and then everything goes back to normal and you fully heal. As opposed to chronic. Chronic is often considered milder, but that's not necessarily part of it. It usually has to do with an extended period of time, and oftentimes there is histological changes. There are measurable changes in the tissue. Excuse me. For instance, an acute inflammation will be red and hot and painful and swollen and probably immobilizing, but it clears up and goes away. It lasts for a fairly short period of time. Chronic inflammation, on the other hand, you start to get granular tissue. You start to get changes within the cells of the tissue that is chronically inflamed. And once that happens, there's usually no resolving and going back to the way that it was. So an acute inflammation, so say you catch a volleyball on your fingertips and you jam a knuckle, you will have acute inflammation of your interphalangeal joints, as opposed to you have rheumatoid arthritis in your interphalangeal joints, and that's chronic inflammation. It lasts much longer, and there's tissue change. Subclinical is there are pathological changes, but no manifestations of the disease. So this is, in terms of what we're dealing with right now with COVID, these are the asymptomatic people with the infection. They have the changes, they have the infection, they have the viral load, but they're not manifesting any symptoms, and so they are subclinical. Latent is a term that we use to say that it's inevitable, it's going to happen, but it hasn't happened yet. It's different than subclinical. Subclinical never or usually doesn't progress to a clinical disease. Latent will. So you have been exposed to COVID, you have the viral infection, but there's an incubation period where you're not getting any symptoms. And in the case of this, it might be 10 days or 2 weeks. And then you get sick. So that's the latent period. There's kind of no going back once you get started. The latent period, if you remember from physiology, is the time between stimulation at the neuromuscular junction and contraction of the muscle. It's the time when it hasn't happened yet, but it's going to happen. Prodromal is nonspecific signs during the early stages of a condition. So you have a viral infection and you kind of have a little bit of malaise, but you don't have any specific things. You just kind of feel like shit. That's prodromal. Oftentimes, people that suffer from classic migraine have prodromal symptoms of visual symptoms. They have a visual scotoma where they have trouble focusing on things. And that's an indication that a migraine is about to start. We can look at things as angina as maybe prodromal to heart attack. It's quite possible, you know. Manifestations are a collection of the signs and symptoms. So the manifestations of COVID are fever and maybe trouble breathing and achy joints and things like that. A lesion is a broad term that means any histological change in a tissue, any local change. And it might be acute, like inflammation, or it might be chronic. It is, like I say, it's a kind of a catch-all sort of thing. A lesion is something wrong. So a mole is a lesion. A tumor is a lesion. A cut is a lesion. It's just the change. Syndromes are a lot like diseases, except they could be from a number of different causes. So, for instance, the one that comes to mind is Cushing's syndrome. So Cushing's syndrome is has a lot of the same manifestations as diabetes. It's a high blood sugar situation that's actually caused by excessive gluconeogenesis in the liver, too much sugar being made of non-sugars. Now that could be it could be a problem of the adrenal gland, which is producing too much cortisol, which causes gluconeogenesis. It could be a matter of a tumor, especially a lung tumor, that is producing cortisol inappropriately. It could be iatrogenic and the result of taking prednisone or corticosteroids to treat something else, and it's a side effect. All of those things will lead to this condition called Cushing's. Now, Cushing's disease specifically is when it's an adrenal gland malfunction. Cushing's syndrome is when you have Cushing's from other causes. So remission is when the manifestations disappear. So if you have cancer and you go into remission, the manifestations have disappeared. Exacerbation is severity increases. So things get worse, they exacerbate it. Complications are secondary problems due to the original disease. So if you, or original condition. So if you break a bone, the original condition is the fracture. But if the bone, the broken end of the bone severs blood vessels and you bleed, that's a complication of that fracture. If the bone sticks out through the skin and you end up with an infection, the infection is a complication of the fracture. If you've had a heart attack uh, and you're having trouble breathing and you end up with pneumonia, it's the trouble breathing is a complication, but the pneumonia is a sequelae. So complication is a secondary problem. The sequelae is another problem arising out of. So you have trouble breathing, you have trouble evacuating or ventilating your lungs because of a heart condition, and because you're not ventilating properly, you end up with pneumonia. The pneumonia is a sequelae. Convalescence is a recovery period. It's, so people that are staying home and convalescing after a surgery are recovering. Morbidity and mortality are interesting. So morbidity is actually how sick it makes you. Mortality is how likely is it to kill you. So morbidity is how sick it will make you. So, for instance, pancreatic cancer, at least in the early stages, has a very low morbidity, but pancreatic cancer has a very high mortality rate, whereas the flu has a high morbidity rate, but a reasonably low mortality rate. Most people recover. Epidemiology is the study of disease tracking. So epidemic is, demic means people, epi means on, so it's on the people. So an epidemic is when a lot of cases are found in a given area. Pan means everywhere, so pandemic, on all people, is cases all over the world. So incidence is the number of new cases within a given time period. Prevalence is is how many cases there are. So, for instance, the prevalence of AIDS is much higher than the incidence of AIDS. Excuse me, because there are more people with AIDS in a given society, but there's relatively fewer new cases of AIDS. So, so diseases that have a low mortality rate, generally the prevalence is higher than the incidence. A disease that kills you quickly will the incidence, the number of new cases, and the prevalence, the number of cases that there are, will be a much closer number. So there's a lot more terms that are relevant, and as they come up, we will talk about them.